Hello, I am Sylvia Azania, and in this video, we are going to talk about poor response to ovarian stimulation. We will talk about what low response is, whether it can be predicted, and about the consequences of poor response in an IVF cycle. We will also explore potential solutions for those who respond poorly and address some of the most common, frequently asked questions users may have concerning this subject matter. Low ovarian response is defined as a low number of mature eggs obtained after the process of ovarian stimulation in an IVF treatment. Nevertheless, specialists do not have a universal consensus for defining a poor response to ovarian stimulation. According to the Bologna criteria, a low response is considered to be present when at least two of these criteria are clearly met: a maternal age over 40 or any other potential risk factor for low response. Previous cycle with low response. A cycle is considered to have had a low response if 3 or fewer oocytes are successfully obtained after following a standard ovarian stimulation protocol. Ovarian reserve test that shows a decreased result. Antral follicle count that is lower than 5-7. Or anti-Müllerian hormone below 0.5-1.1 nanograms per milliliter. Furthermore, it is also considered that a woman is a low responder when, after undergoing 2 cycles of ovarian stimulation at maximum doses, 2 low responses are obtained. Nevertheless, the later classification by Poseidon managed to achieve a superior stratification of the female patients, depending on the age, under or over 35 years old, and ovarian reserve. An antral follicle count greater or less than 5, and AMH greater or less than 1.2 nanograms per milliliter. The frequency of a low response to ovarian stimulation during fertility treatments shows variability, but it is estimated that it appears in 9 to 24% of patients. Therefore, it is essential that the fertility treatment, along with the ovarian stimulation protocol, is customized right from the start. And before we continue with the content of this video, I'm going to ask you please that if you are enjoying it, give it a like and subscribe to the channel if you haven't already, as you help us a lot to continue and for all the information we publish to reach more people. Cases of poor response are confirmed after the ovarian stimulation has been performed. Even though the reasons for poor response are not completely understood, several related factors have been documented. These markers could help predict poor ovarian response to the drugs administered during the process of ovarian stimulation. Age, a factor that is found to be inversely related to ovarian reserve. At an older age, a lower number of eggs, and the response to ovarian stimulation will be worse. The aging of the ovarian tissue, an ovarian mass reduction, due to surgery, chemotherapy, or endometriosis. Autoimmune process. Hormonal alterations, toxic exposure, smoking or drinking, an increase in body mass index, and also genetic factors. And if you want more information about how to estimate ovarian reserve, you can read the article I've included in the tags and description. The goal of controlled ovarian stimulation in an IVF treatment is to retrieve a sufficient number of eggs and achieve the transfer of at least 1 embryo. Therefore, the objective is for several ovarian follicles to develop, unlike what typically happens in a natural cycle where only 1 egg is released. That is precisely why the low response of the ovaries has undesirable consequences, since a low number of eggs are obtained for fertilization. That way, the probability of pregnancy decreases, since there is an increased risk of having to cancel the planned embryo transfer procedure. It is possible that the poor responder woman needs continuous accompaniment and emotional support, since the chances of canceling the cycle are higher and having to repeat the stimulation treatment a greater number of times. Moreover, the quality of the eggs might deteriorate, particularly when the underlying cause is related to age. This compromises the ability to obtain viable blastocysts for the transfer, which would worsen the situation for these women. Currently, more experimental techniques are beginning to be used to address cases of low ovarian response, such as ovarian renewal. Nevertheless, beyond these more experimental choices, there are various alternatives available for women experiencing poor ovarian response during fertility treatments, converting an IVF cycle into an IUI cycle. If only one or two follicles are clearly observed during an ultrasound scan, the option of converting the in vitro fertilization or IVF cycle into an artificial insemination cycle may be contemplated. This is only possible when the other factors are taken into account, and provided there is no severe male factor present. Pre-treatment with androgens. After having undergone a low-response ovarian stimulation cycle, a specialized androgen pretreatment may be attempted to try to obtain a greater number of follicles in the stimulation. These treatments may involve the use of transdermal testosterone or with DHEA, although its efficacy in these cases has not been proven. In order to obtain a greater number of eggs in the laboratory, which increases the probability of obtaining viable embryos for transfer, several cycles of oocyte accumulation would be performed. It consists of vitrifying all the eggs obtained in each cycle until you get an optimal number. It is then that they become devitrified, combined with the mature eggs obtained in the last puncture, and ICSI is done to fertilize them. It is also entirely possible to carry out this same egg accumulation strategy by performing 2 stimulations in the same cycle, which is known as double stimulation. And finally, egg donation. When several cycles of IVF have already been canceled due to low ovarian response, the most successful alternative would be egg donation or ovodonation. In vitro fertilization using egg donation, the eggs provided by an egg donor are fertilized with the sperm of the recipient woman's husband. This particular reproductive option boasts very high success rates, but it carries the major disadvantage of having to give up the woman's genetic load, and also its high cost. Considering the current trend of delaying motherhood among the general population, egg donation is a practice that is currently used by all assisted reproduction clinics. As the woman's age increases, the quantity and quality of her own eggs decrease. For this specific reason, egg donation may become absolutely necessary to achieve pregnancy, in the case that the woman has not previously preserved her eggs. You can read more information about egg donation in the link I leave you in the tags and in the description. We will now proceed to address several of the most common inquiries that users might have concerning this particular subject. Can I get pregnant with low ovarian response? It may be more or less complicated, but it is possible to achieve pregnancy with low ovarian response. When a low response to hormonal medication is observed during the course of a fertility treatment, there is a possible solution, as changing from an IVF cycle to artificial insemination. Another alternative would be to modify the ovarian stimulation protocol, or accumulate oocytes during several cycles. As a final recourse, pregnancy could be achieved in women with low response through in vitro fertilization using eggs from a donor. Are low reserve and low ovarian response the same thing? No. Ovarian reserve refers to the total number of eggs available within a woman's ovaries at any given point in her life. For example, if the woman starts with a maximum of 6 follicles and 4 mature eggs are obtained from the puncture, it would be a normal ovarian response. In contrast, low ovarian response occurs when the ovaries do not respond as expected to the specific hormonal medication administered during the ovarian stimulation process. We would love to hear about your experience, so please share it with us in the comments section.